Hi, everybody. My name is Jenna Headland, and I'm excited to present to you today about fetal alcohol spectrum disorder. So, throughout history, alcohol has been a prevalent part of culture since thousands and thousands of years ago. We see alcohol being drank in the Bible, which was thousands and thousands of years ago. And it is still the most common drug that's used by women of the reproductive age. And it wasn't determined that there was a strong link between alcohol and the developing fetus until the late 1960s and 1970s. And now, in today's culture, most people, most women, know not to drink alcohol while they're pregnant because of a lot of the negative effects that it can cause on that developing fetus and developing child. However, there's still almost 10% of women that still use alcohol while they're pregnant. And this can lead to different effects with reproduction, conception, pregnancy, and even postpartum stages of childbearing. So the epidemiology was really shocking to me. I had no idea that there was such a prevalence of this condition in our culture, especially with the awareness that most people have of how negative the exposure of alcohol can be to that developing child. But the prevalence in the global population, from one of the sources I found, says it's about 0.77%. And that's even higher in Europe and North America, with 2% to 5%. And fetal alcohol spectrum disorder is actually as common as autism spectrum disorder, which has a global prevalence of 0.6%. And it's very underdiagnosed because a lot of the times the symptoms are very similar with those of ADD, ADHD, even autism. And a lot of the times the mother may even be in denial of using alcohol while she was pregnant. And the prevalence really does differ based on culture, location, socioeconomic status, and things of that nature. It's really difficult to diagnose, and as I said, it is often misdiagnosed. But unfortunately, it is the leading identifiable cause of intellectual disability, and it's one of the most preventable developmental disorders. The pathophysiology of FASD refers to, FASD refers to really an umbrella term that characterizes a cluster of ethanol-induced effects caused solely by alcohol consumption during pregnancy. So similar to autism spectrum disorder, when you look at that, that's an umbrella term for a wide array of different symptoms and things like that. FASD also is that umbrella term where there's a range of different symptoms that can occur, differing how bad this condition is based on the symptoms. And so not every single FASD case and client is going to look the exact same. Exposure to this ethanol, which is in that alcohol, during the entire gestational period may cause damage to the developing fetus. And it's known to decrease DNA synthesis, inhibit growth factors and protein synthesis, and reduce available glucose, which are all necessary for healthy growth and development. Without those things, we see a lot of different misdevelopment, and there's different things that happen with the CNS, with the brain, and the whole entire developing fetus can be disrupted because of this exposure to a simple ethanol molecule, which can break through the child's skin barrier and stays in their system quite a long time. So it impacts brain development in the fetus and results in delayed behavioral and developmental effects throughout the entire life cycle, with or without the presence of physical symptoms. Now, I touched on this a little bit on the last slide, but at a cellular level, the alcohol damages the mitochondrial morphology and function. So that mitochondria is the powerhouse of the cell and plays a large role in that cell production and the protein synthesis. And without that, this might interfere with cellular respiration and result in an oxidative stress to the developing fetus. And we can see this affects the vascular diameter in important organs such as the brain, the heart, the liver, because those are all regulated by the mitochondria. And if that mitochondria morphology is being affected by that ethanol, that mitochondria isn't going to work as well to help regulate all those organs and create the child. And at a nervous system level, the alcohol exposure can both affect neutrophil survival and development and function in the central nervous system. However, with prenatal alcohol exposure, this may disrupt the neutrophil activation, which can contribute to cognitive and physiological deficits in the infants. And really, the symptoms and the course that this child will experience, it really is all linked to the time that the mother was drinking based on the development. So if the mother's drinking while the baby's experiencing that period of brain development, then the brain might be what is most affected. Or if the mother's drinking earlier on when the baby's physical features are being developed, that's what's mostly going to be affected. So it really, the link to the symptoms and the deficits that that child may experience later in life or once it's born is really linked to the time and the amount of alcohol that was drank by the mother while she was pregnant. So the clinical course here, while the mother's pregnant, there's a risk for poor fetal growth, as I've said, as well as preterm delivery and fetal malnutrition, which also may lead to fetal growth or even a loss of that child. Another source that I found said that there may even be changes in the epigenetics that can influence fetal growth and the embryonic development. At birth, the majority of newborn infants will most likely be asymptomatic and non-dysmorphic. So they may appear to not have any issues right away, which makes it really difficult to diagnose the intrauterine exposure on a clinical presentation alone at birth. However, as I said, it really does differ based on the amount of exposure, based on the time of exposure, and all different FASD cases are very different, and some infants have been shown to present a unique withdrawal symptom if they've been exposed to excessive amounts of alcohol. And this can lead to abdominal distension, as well as a variety of other symptoms. The clinical signs are varied based on the amount of alcohol the mother's drank and the time of exposure. So other symptoms that you might see at birth would be tremors, hypertonia, restlessness, and things of that nature, and those withdrawal symptoms. Now, the symptomology, again, it really differs based on the child, but some of the most common symptoms would be a low to average IQ, poor executive functioning, a lack of social and communication skills, lack of appropriate initiative, poor judgment, failure to consider the consequences of their actions, poor concentration, poor attention abilities, social withdrawal, and even intermittent anxiety. So as you can see, those symptoms overlap a lot with autism, ADD, and some of those other really common conditions in the pediatric population. So that's another reason why this condition is so often misdiagnosed as autism or ADD. However, there are some physical symptoms that are associated with FASD, and those include some facial deformities. So you can see this photo that I've included in the slide shows some of those common facial deformities, such as a really thin upper lip. That's really like the universal sign of FASD. A short nose, an indistinct philtrum, so that little lip that you have right above your upper lip, where you have like a little curve in that skin up above your lip, that's not there a lot of the times in children that have FASD. They can have a flat mid-face and short palaparebral fissures in their eye region. And you can see there's another list here that just says a few more physical dysmorphologies that are associated with FASD. Unfortunately, it's very, in my opinion, I've actually seen someone that has FASD, and they actually had a lot of these physical symptoms and physical I'm sorry, facial dysmorphologies. And so it was pretty clear to me that this child had FASD just because of that when they were actually misdiagnosed with autism. So, from my experience, I've seen these physical symptoms, and but these physical symptoms often don't develop until that child is a little bit older. So the prognosis, unfortunately, there is no cure or specific treatment for fetal alcohol syndrome or fetal alcohol spectrum disorder, and the physical deficits and mental deficiencies typically persist for a lifetime. So just like you see in conditions such as autism, really it's a lifelong condition. There's no cure. There's no specific treatment for FASD. But there are some early intervention services that may help reduce some of the effects of this condition and may prevent some of those secondary disabilities. And again, the prognosis really varies based on the symptoms and the severity of the condition. Occupational therapy does have a role in FASD. They can, just like any patient we see, our goal is to help that patient achieve the occupations that are most meaningful to them. So as a patient that has FASD, they're still going to have occupations that are meaningful to them, but they might have limitations that are inhibiting them from performing those occupations. So some of those common limitations might be fine motor skills, such as handwriting or the ability to grip a pencil and draw, things like that. And so as an occupational therapist, they can work with fine motor skills and motor planning skills and help develop those abilities. Self-care and daily living might also be affected. And so occupational therapists can come in and help with task analysis, skill training, and other things to help with their self-care and their ADL abilities, their play skills. If they have a limitation in those fine motor skills, those motor planning skills, the ability to communicate with others and socialize, if they have anxiety or some of those other symptoms that we saw earlier on, that might limit their ability to play, and especially play with other children. So the occupational therapist can come in and just help them with those motor skills, help them learn to play, help them with play therapy, and just developing those play skills that are so important to the child. Self-esteem and social skills are another common symptom of FASD, and so when those are inhibited or limited, the occupational therapist can help the child regain some of those social skills, some of that attention, some of that self-esteem, help with the anxiety and things like that. And then finally, another common sensory processing behavior and regulation can be treated by an occupational therapist through the use of visual schedules, sensory activity schedules, cognitive strategies, and things of that nature to help that child with their sensory processing and regulating some of that behavior. So ultimately, occupational therapists develop intervention goals jointly with their clients and their families to increase participation in those meaningful occupations and activities of daily life. And that early intervention is really important in the development of that child. So I found some community support agencies for FASD. I'm sure as a parent that has a child with FASD, it's probably really difficult to find support. And also, another thing that I saw as I was researching for this presentation was that a lot of the times there are children that are adopted that have FASD. Their parents don't want them, and so they give them up for adoption. And there are people that do adopt children that have FASD, so these support agencies would be very beneficial for them as well. There are 2 PDF resources that I have linked here that are just some, one of them is a daily guide for living with FASD, and another one is just some strategies for parents that have children with FASD. And then I found a couple different support agencies. One of those is some support groups. They are based out of Minnesota, but they do have some online virtual options. So you could always join a support group through the Proof Alliance. And then there's actually a whole list of different resources that Michigan offers. So 2 of those here. One of them is the MC Fairs, Michigan Coalition for Alcohol Resources, Education, and Support. So if you click on that link, it'll take you to their website, and they offer a variety of different events. They offer a variety of resources and support for children, parents, families that have children with FASD or other alcohol-induced conditions, as well as they offer a lot of awareness, and their goal is to raise awareness to prevent FASD. And then finally, the last link I have here is the Michigan Alliance for Families, and this is just a basic organization that offers assistance for families with financial struggles or children that have disabilities. So this is a great resource if the family is struggling financially to get some state assistance with their child. So thank you so much for listening to my presentation today. I apologize for my stuffy voice. I'm actually getting over a cold, but thank you for bearing with me. I hope you learned something new today. I know as I was researching for this presentation and putting it together, I learned a lot, and I think the main thing that we need to take away from this presentation is just how important it is to raise awareness of FASD, since this is such a preventable condition. The number one way to stop it isn't to find a cure for it, but it's to raise awareness of some of the effects that can come from prenatal alcohol exposure. So I hope that you will join me in advocating for preventing FASD in any way that we can as future occupational therapy practitioners. And here are my references.